please. Now, let me introduce Dr. Faten Moftah, who will present one of life-saving measures بإذن الله. Dr. Faten is the Executive Director of Egyptian Society of Blood Services, President of Africa Society for Blood Transfusion, former head of Egyptian Ministry of Health for National Blood Transfusion Society. We welcome Dr. Faten, please, Doctor.
Good
Dr.
day, everybody.
Yes.
At the beginning, I would like to thank very much the organizers of this very important Congress or conference, and I hope that our sisters and brothers in Gaza will make use of it. My presentation today is about blood transfusion under limited resources in the situation of siege. And we all know that the war on Gaza now is extremely unfair. In this situation, all kinds of supplies, including basic and medical needs, are very restricted and sometimes not allowed altogether. Simultaneously, the number of casualties are dramatically increasing, needing medical and surgical instant attendance. Officials in healthcare establishments are required or expected to provide care even under these very tough situations. Healthcare personnel need to be innovative and think of a robust basic alternatives. My presentation today, before I go to and recommend what to do in these situations, I would like to remind all of you about the dynamics of transfusion chain in the normal situations. Usually we start by the national program for recruitment of potential blood donors, spreading the awareness and motivating the donors to come and donate blood. And this is one of the very difficult steps of the transfusion chain. Blood donors then, when they come to the blood banks, they are tested for their suitability and fitness to give blood, and we call this screening and selection of blood donors. Then the blood is collected in a special blood bags that will allow for further handling afterwards. Then those blood bags with the samples are transported under temperature-controlled equipment and vehicles to the premises of the blood bank. Then the blood samples are tested for transfusion-transmitted infections and immunohematology parameters. Those blood bags are treated in a way with some equipment to generate components and prepare components out of the whole blood donation. Components like red blood cells, fresh frozen plasma, platelet concentrate, cryoprecipitate, and others. Those blood components are then stored under very strict temperature conditions, which we call it cold chain, and then they are later on issued to health institutions where the patients are. Blood components prescription are very, very many. We have numerous medical and surgical situations that need blood to be prescribed for them. Before we transfuse blood to patients, we have to do compatibility testing and do the administration of the blood into the patient's venous system. And then the health institution staff, especially nurses, they observe the transfusion for any unwanted reactions. So this is the normal chain in a very summarized way. I would like to reflect on the chain in the normal situation. This whole chain is very sophisticated and needs quality system in place. And the most difficult steps in this chain is the very first one and the second one before last. So let me talk about the first one. blood donation worldwide is decreasing due to many reasons, such as young people are not interested anymore in blood donation. There are situations like the pandemic, situations like discovery of new viruses that were not known before, and these new viruses disqualify some of the donors, so making the donor base shrinking more and more, and the donor base is aging in many countries. Blood components at the same time are still, the needs for blood components are still increasing, and the supply is much less than the demand. Now, the other step, which is the prescription of the relevant component to the patient, it is usually a tough step because doctors have to think about what component, the volume of the dose, the frequency, and when to stop, when to start, and for all their situations, and these situations can be medical or surgical. And usually this step needs a very huge experience and skills. Naturally, this chain needs the use of software operated sophisticated equipment, needs very stable power supply, needs internet, needs running clean water, and all these situations are not there in disasters or siege. On the other hand, I will give you a glimpse on the dynamics of transfusion chain in emergency, disaster, or siege situations. To start with, there is usually an influx of volunteers, of potential blood donors. You don't have to go and find them. They come and find you in the hospitals. Blood donors screening and selection and record keeping is usually compromised. Blood collection in special plastic bags is usually not feasible, except if you have barely single blood bags. Blood transfusion under temperature, uncontrolled situation is always the situation, and it's doubtful that you can control the temperature. Blood testing for transfusion transmitted infections and immunohematology parameters usually very primitive. Components prescription like red cells or FFP or others, usually you don't have a need for these components. The blood storage or the cold chain situation and issuing to health institutions is usually not there. You don't need it. Blood components prescription for numerous medical and surgical cases, indications are mostly in one indication, which is the massive bleeding of the injured people. Compatibility testing and administration of blood and observation of patients during transfusion very much compromised because of the lack of medical staff. If I reflect on this chain under the siege situation, ironically, the easiest two steps are the one and the second one before last, which is the opposite of the normal situation. First, because the whole society is emotionally driven to help. Everyone wants to donate blood to help the injured, and the supply or the potential supply is usually more than the demand. And then when it comes to the prescription, usually you are not faced with all these kinds of patients because the hospitals are now only attending the injured. So in this case, the only indication is transfusing blood to compensate for blood loss. And usually you transfuse here whole blood to combat the bleeding. And in the whole chain under siege, there is destroyed functioning infrastructure, and people are trying to go basic with old-fashioned methods and supplies to manage the situation. There are here some of the challenges of transfusion chain under siege that are recognized, like limited or no supplies to run the decent transfusion services, interrupted or absent power supply, which is essential for all operations. Clean water is either absent or scarce or spoiled, whatever. Again, clean water is essential for all operations. The focus usually is on the casualties and the trauma cases. Other medical and surgical cases are usually compromised and are not attended to. Chaos also is everywhere, leading to difficult management of donors and patients. There is abundance of volunteers. Many people want to help, and we have to consider that this is a very precious resource for many tasks and should be considered and utilized. There is also compromised or no documentation altogether, which usually is very important for the health services in general. But in here we have to think fancy medicine versus siege reality improvisation situation. So in this situation, I think hospital and blood bank staff can recruit volunteers for several roles. They can provide crash or quick training courses for volunteers to perform these different roles. They can also think of alternative methods or alternative supplies. For example, basic method like glass slide test for blood groups or cross-matching for compatibility, or like using rapid testing kits for transfusion-transmitted infections, etc. We need to go to basics in this situation because the fancy tools are usually distracted. Use the basic manual methods to suit the available resources without compromising the patient's health. And for example, if we do just simple blood grouping and simple cross-matching and testing very rapidly to the presence of any infectious disease, it's better than giving blood without any handling altogether. And ask the donors, international donors, for non-perishable basic supplies and not the perishable sophisticated ones. As I mentioned before, rapid testing kits, for example, or single blood bags rather than multiple blood bags. What are some examples of roles for volunteers? They can organize the chaos happening around the health institutions. They can assure the crowd. They can deliver basic, easy information about blood donation. They can organize the potential blood donors according to their blood groups, according to their age or gender. Keep simple records of them and their reaching contacts, and then we can call them later during the need of them. Those volunteers also, if treated quickly, can do easy stuff like carrying the supplies or the goods, like carrying the patients even, or the injured patients, like providing refreshments for the donors or even a glass of water. They can do screening and selecting of the suitable potential donors. They can do things like warming up the casualties, clearing the airways, compressing the bleeding, simple compressing of the bleeding to help in alleviating the consequences of severe blood loss. If they are treated also, they can become phlebotomists, or they can collect blood from the donors. They can do the mixing of blood with the anticoagulant. They can watch donors for any reactions. There are so many easy, straightforward roles that they can be doing to also relieve the burden on the hospital staff. What are the reasons or indications for blood transfusion in the normal situation? There are many indications for the blood components, but can be summarized into two main categories. The first category is the compensation for the volume, like, for example, cases of road traffic accident or even casualties in the war who are suffering for massive blood loss. There are also intraoperative patients who sometimes experience uncontrollable bleeding in the field. There are also perioperative or peripartum hemorrhage for women. So there are a lot of situations when the volume is compromised and you need to transfuse to combat the volume, because we all know that hypovolemic shock is much more detrimental than caring for the blood is conveying any or transmitting any infection. The second main category is to compensate for the constituents. So we have cases of patients needing red blood cell mass, like patients with anemia or patients with coagulopathy that need platelets or cryoprecipitate or coagulation factors. We have immune compromised patients that they need IVIGs, etc., etc. So these two main categories of reasons, they have under them numerous indications. But reasons and indications of blood transfusion under siege in disaster situations, we can again go to the same categories. So if we talk about the volume, we can, instead of in case of the non-availability of the blood, we can use fluids like crystalloids. They are non-perishable, they have much less side effects, and they are easy to be donated by the neighboring countries, and they don't need cold storage. We can also use colloids, but usually they are more complex, and sometimes they give reactions to the transfused patients. If we go to the second main category, which are the constituents, actually whole fresh blood is the component of choice in this situation. It is usually the only available choice. And as well, it contains all the constituents plus the volume. Because in this situation, there is no luxury to prepare components. I will go over some of these examples in a little bit elaborative way. So if we are talking about use of the fresh whole blood in the normal situation versus Gaza situation. In the normal situation, fresh whole blood is an old-fashioned component. It is considered a waste of a precious resource because in this case, we don't recover the coagulation factors from this resource. It is used in a very limited indications, like compensating massive hemorrhage, and it is not available in most of the decent blood sources anymore, and it can be provided in the battlefields. If we go to the Gaza situation, fresh whole blood, it might be the only component of choice because it might be the only available component. All what it needs is the use of single blood bags, which is easily can be donated by international agencies, and blood can be collected in single blood bag, tested using the rapid testing kits without need of cold chain or storage, and it is very useful for all those many injured situations in the war situation. I did mention about the use of rapid testing kits for transfusion-transmitted infections. Again, in the normal situation, the use is very limited to remote areas with compromised infrastructure, like some remote villages in sub-Saharan African countries, or some remote villages in some of the South Asia. Usually these kits have less specificity and sensitivity, compromised a little bit, and they need no automation at all to be functioning. In Gaza situation, we don't need or we don't have cold storage luxury, so rapid testing kits are good in this situation because they can be stored in either room temperature or ambient temperature. can be donated and transported easily by also neighboring countries or international agencies, because the packages are much smaller than the sophisticated ones, and they are also much cheaper. They are very quick in releasing the donated blood for the injured bleeding casualties, because the test itself takes very short time. It's very fast and it's very easy to use and to conduct. If we go to immunohematology, the simple basic method is using the liquid antisera packaged in vials and use the glass slides. Usually in the normal situation, this method is less sophisticated, completely manual, but it is time consuming for bulk batches, especially in the big blood banks. They cannot use it. It is also risky because it can expose the workers in the blood banks into the hazard of infection. It has a higher rate of false positive and false negative, and it does not help in all immunohematology parameters, such as identifying red cell antibodies, for example. But in Gaza situation, using liquid antisera and the glass slides is very easy, because also again it is compact. It can be stored in the room temperature or ambient temperature. It has very fast results, can be done by less experienced staff or even volunteers. It gives reliable results in this situation, and it doesn't need power supply to be conducted. I mentioned also about the use of single blood bags in this situation. They are, as I said, cheap and straightforward to be used. They collect whole blood, and donors can be tested for their blood groups and for their suitability to donate blood. And those donors can await to be called later on to give blood. And after giving the blood, immediately we do the TTIs testing with the compatibility testing, and blood can be transfused very quickly. Storage here is skipped, because you call the donor, you bleed the donor, test the donor, collect the blood, transfuse the patient. No storage is needed in this situation. One components that can contain all the constituents and can fit for massive blood loss and can fit for other reasons as well. It's the only option, and it is robust. In these situations, the donating and transporting agencies and countries, they have roles to play. For example, they need to communicate and coordinate with the health authorities and officials for the particular useful needs. We need to ask them, what do they need? How can they handle the donated supplies? We must also find alternatives to the traditional sophisticated methods that can be useful. Manual simple can be done by staff with limited experience, with the absence of infrastructure. Send as much as you can non-perishable supplies, because there are no controlled storage situations. Send, if possible, ready tested blood components, if this is permitted. If there are volunteers from the medical field, they are very much welcomed if the war situation allows. At the end, I would like to reflect very briefly on this talk. In this situation, there is no standard operating procedure for what to do, even though all health institutions, they have in place contingency plan or emergency plan. But what is happening in Gaza is much beyond contingency, much beyond emergency, much beyond anything. So there is no particular SOP, but improvising, using our experience, using our skills to do whatever we can do as much as possible. In this case, going basic is usually the only choice. International donors are required to be realistic and prompt to help. We must consider the infrastructure status and act accordingly. At last, please cease fire. Thank you very much for listening to me, and good luck to all of you.